Is a presentation by Yachin Davis, David Duckett, Heather Garfield, and Melinda Woolard. We'd like to first talk with you about a very unique subject and actually a little bit more personal topic, which involves STDs in seniors. Breaking the stigma and raising awareness. That's what this topic will focus on, and we wanted to make sure we brought you along. Today, we want to take some time to discuss with you sex education for the 60 age range plus population. Contrary to popular belief, not everyone slows down as they physically age. Across the span of research that we've been able to conduct over the past several weeks, the consensus was that seniors feel that they are in their prime of life as in this stage of their life. Their kids are grown, maybe their kids have also graduated college, they're retired from the workforce, they're nearing retirement or already retired, and in general, they are living the second half of their lives. However, when you discuss the topic of sexuality, many folks may consider this to be a discussion of sexual education, may consider this as just for adolescents. However, that is what we are wanting to discuss with you today. The CDC reported very recently that within this conversation and within the topic of older adults, within the past decade, the number of adults that have presented with STI or sexually transmitted infections has nearly doubled, if not more than doubled, within the past 10 years. The question becomes for nursing professionals, providers, caregivers, is how do we address that? And that's what we'd like to focus on. Given the characteristics, that is of this population, it's very important to address the stigmas and the sexuality of the older adult. When it comes to communication with elderly population, we can't count them out because of the age or their sexual orientation. They may be very nervous or as nervous as the common man or woman to talk about a personal aspect of their life. Bringing up their sexual history to their provider may not be what the average adult or older adult wants to do. And that is why it is really important to address the societal stigma around sex, education, and how can we deal with that. It's important as healthcare providers, that we continue to address sex education with every annual physical visit. As healthcare providers, it is, our due diligence to ensure that we offer a safe environment for open communication. If and when the topic is addressed, and we want to make sure that the patients are comfortable and in such a way where they're not feeling anxiety or afraid to discuss with their healthcare provider exactly what they're feeling. According to the Journal of Marine Medical Society, published on an article titled Sexual Behavior and Increasing Vulnerability of Elderly Patients about STIs, this was back from 2022 in July. The study researched patients over a 1-year period in an STI clinic and found that a majority of their patients were over 55. Many barriers were found during the study. Most patients reported they were monogamous, but they were also positive for an STI. This finding was a clear understanding. It was a barrier since patients in general may be embarrassed to talk openly about their sexual history. Women would have symptoms, they had symptoms, but refused to believe they had an STI. Another barrier was finding that many women believed they were not at risk after menopause. And that's what we want to address. In general, older people feel they are less prone to contracting an STI. Another barrier when we start understanding and bringing it all together that exists is the general idea that the older adult is not sexually active. These are some of the barriers to understanding and bringing all of this together when it comes to how we talk about it as providers to the older adult. Because the goal, bottom line, would be, hey, we want to prevent sexually transmitted infections in the older adult population. We address knowledge gaps, the hesitation that they may have, the risk even after menopause, and even the denial. Considering multiple things carrying on into the next conversation about this is the misconceptions. In reality, age doesn't defy sexuality or necessarily decrease libido. So we talk about truth or misconception about the older adult sexuality. The misconception, sometimes or many times, adults over the age of 60 no longer participate in active sex. No matter whether we or the general population may see an ad for a new medication for ED, whatever the case may be, we're going to talk a little bit more about that. The truth regarding there have been several studies conducted from the years 2019 to 2023, and they highlight the impact that the rise of STIs has had on older adults. Truth, older adults are still looking for love, compassion, and intimacy, and often because of a weakened immune system, well, they become a little bit more susceptible to STIs, especially HIV. A misconception in turn of maybe, something that needs to be addressed is that elderly adults, this is a misconception that they are practicing safe sex. We address the part where, the misconception is that older adults aren't having sex, but then we can also address the misconception that the elderly adults that are, they're having safe sex. They're older, more knowledgeable, wise. The truth is that most primary care providers don't inquire about sexual health. That data, it tends to be a little sparse on STI rates affecting the aging population. However, as more data is gathered, it's critical to understand the role that the nurse, the provider, the caregiver has in this entire conversation regarding what we believe about the older adult and their sexual health and sexuality. Ageism does this is some of the misconceptions. Ageism does have an impact on the elderly population when they are stereotyped into believing they are too old, sex is inappropriate, or they lose interest. Older women don't actually lose interest in sex after menopause. In fact, it often increases. Several studies have shown that older adults are engaging in sexual activity at higher rates than in previous decades, leading to an increase in sexually transmitted infections and HIV infections. Overall, when we talk about the impact this has on the older adult, as adults age, their quality of health typically decreases with a weakening immune system, an increased prevalence of multimorbidities, and leading to an increased susceptibility for infection. Studies would suggest that the burden of HIV and other sexually transmitted infections is high. It's substantial in older adults in both high income and low income countries. Comorbidities like diabetes, hypertension, so on and so forth, well, they can decrease the desire for sexual drive or desire. They can decrease your sexual drive, but it doesn't necessarily impair it. As the body ages, physical and emotional changes occur, leaving a person to feel vulnerable. These changes can occur due to fatigue, reduced hormone levels, or decreased sexual function. Some elderly population may be at risk for disturbed body image due to varying surgeries. Mental changes, including anxiety or depression, can be a significant barrier for lack or any intimacy at all. There are some medications that can, in fact, decrease stamina uh, or erectile dysfunction, but overall, this discussion it grows a little bit more when it comes to understanding the older adult and how their life changes impact their sexuality as a whole. When we consider the testing and the treatments that are associated with STIs in older adults, sure, sexually transmitted infections, they may involve a quick lab test. But another important aspect of this entire conversation involves what knowledge do the older adults have? Are they being actually properly prepared for that stage of their life where they're a little bit older? And that's where me and you, as nurses, providers, we come in. Because here it is, what if a lot of sexually transmitted infection transmission, the transmission part, is simply because, to call it plainly, there's a little bit of ignorance around the whole topic and subject as a whole. Back in 2020, there was a research study that was conducted to actually test the reliability of sexually transmitted infection knowledge education. Let's see if the tests and the screenings that we're doing are actually effective. Is the older population actually learning and understanding? Testing and treatment is often focused on acute and chronic health conditions, but routine testing should be a part of the primary prevention for aging adults that are still sexually active. Training may be limited to healthcare providers regarding geriatric sexual health, and that's why we are including this discussion and relevance for ongoing education. Physical and medical history are crucial to determine if further testing needs to be performed and rule out undiagnosed STIs that can be an underlying cause to other issues, including but not limited to cognitive changes or urologic changes. Older adults may lack significant knowledge about STIs. There's no standardized tool or measurement for STI knowledge in older adults. However, in this research article, we look at the STD model that really addresses this knowledge questionnaire that addresses, hey, the efficacy of screening a patient before, and then also screening them after to see if they comprehended the education. There is preventative routine testing. It often should consist of chlamydia, gonorrhea, syphilis, and HIV. But because of, like we were discussing, their bodies being a little bit more at risk, it's important to test them for HIV. Considering the actual questionnaire, the STI knowledge-based questionnaire, it is a very helpful tool for providers and nurses to use to assess the older adult patient's sexual health knowledge. But in the event that staff aren't thoroughly able to communicate the importance of sexual health, there are assistance and different things that can take place, from referrals to sexual health counselors, clinical social workers, sex educators, and sex therapists, which can help you address these concerns within your community. The conversation may actually be uncomfortable. Administering the STD-KQ or knowledge questionnaire may be uncomfortable, but that's why there's assistance, just in the event that that is something that comes up. Regarding the STI education testing efficacy, researchers discussed, they did a pre and a post conversation utilizing a 27 data point questionnaire where older adults were assessed on their STI knowledge. What was found was, just in this statement even right here, is that older adults unfortunately have a low level of STI knowledge. And that's why it's so important for providers and nurses to implement a tool. It doesn't necessarily mean this specific tool, the STD-KQ, but a tool to assist those that are engaging in sexual activity in their older age stage of life. When we discuss education regarding this patient population, STIs have been on the rise in the last decade. The AMA states that this increase is due to longer life expectancy, medication innovations such as hormone replacement therapy, and ED meds such as Viagra, which have contributed to an increase in sexual activity among seniors. And in senior living facilities, new friendships are being formed, more social activity is taking place, which often could involve older adults engaging with multiple partners. Unfortunately, there is a low condom use because many associate condom use as a prevention to pregnancy. However, many lack the knowledge of STI and how condoms can help prevent that as well. A general lack of knowledge and discussion with doctors about STIs is also part of the issue. Insurance claims for chlamydia and gonorrhea tripled in the last decade alone. Preventative measures can be taken. For example, doxycycline can be utilized as a morning after pill for STI prevention, along with a Hep B vaccine. But importantly, what can also help is a behavioral modification change and education. That's just where that comes in for the provider and the nurses that are willing to get on board and educate this patient population that is vulnerable. In conclusion, it's really imperative to communicate this part of the discussion where older adults, although there may be misconceptions and all kinds of just stigmas that are associated with the older adult and their sexuality, it's imperative to understand and note that older adults are still human. They still desire love. They still desire sexual identity and expression. It is our part to understand this and address it. We want to decrease poor outcomes in sexually transmitted infections, but oftentimes that first begins with talking about it. Let's screen our patients. Let's create an environment and an atmosphere where they can be comfortable talking with their providers about this. That way we can open up the conversation to discuss how to prevent STIs. Thank you for joining us. We appreciate you.